I just came off of two 12-hour shifts yesterday and today. I'm able to be off today, but there was once again a need. So after I'm done talking with you, I will likely go in and help out my colleagues who are running short.
My name is Amber Christensen. I'm in the final year of getting my bachelor's in the respiratory therapy program at Seattle Central, up in the Health Education Center at Pacific Tower. The woman who starts that video, Catherine Lazaro, is not only a practicing respiratory therapist, she's also a teacher in my program. Where does she get the energy? I truly don't know. She has some hidden power supply, some sense of commitment and duty that never lets up. She's not alone. There's Scott, our clinical director of the program. When he's not teaching the juniors and running labs and making sure that we get all of our clinical rotations, he's also being a respiratory therapist at Providence. That takes a physical toll, of course, but also an emotional one. He talked about it a little with KUOW last year.
And so what's poignant to me as a clinician is witnessing sort of these last conscious moments of these patients who are alone in the hospital with no family around them, sort of communicating these last wishes and or, well wishes to their loved ones.
As students, we don't look after COVID patients yet. Some wondered whether a lot of us would quit the program, seeing what was up ahead. No one quit. A couple came close, but only because they lost the jobs they were working to get through school. But with some help, they managed to stick it out. More remarkable, the cohort of students who comes after us is the biggest ever. My classmates amaze me not only with their determination, but with their diversity. Every gender, almost every age, almost every country. Over the last few years, the program has had students from 55 different countries of origin. 55. And such impressive people. I think of my friend Semhar from Eritrea. If English is her second language, medical terminology is her third, and she's accomplished in all of them. By the time we graduate, maybe COVID will be in retreat. No matter what the future throws at us, we'll be ready. Our program director, Jen Clark, says other respiratory therapy programs set you up to this level. But that's not good enough for the program at Seattle Central. Her grads have to get up to this level. She pushes you, and then she pushes you harder. She knows that we're soon going to be out in the world, and she wants us to be able to think critically, talk to doctors confident in our knowledge. Graduation comes soon. I had so hoped our graduation would be like this. All of us together, being silly in our specialized regalia, ventilator circuits around our necks. When I started the program, I thought about the message I would put on my graduation cap, facing up to the sky, something for my mom who passed several years ago to see. Instead, we'll be taking individual photos by the Iron Lung, snapping photos from 6 feet apart, just like last year's group. And after that, it's into the world, where we try to make an impact in our own way. I can't wait to give it my all.